Hello, this is Dr. Bob, Dr. Anthony, and Dr. DeMaria. Welcome once again to another very intriguing half-hour health program. And I want you to take action today. We're going to give you a lot of information. And this information is to educate you to make wise choices. But before we get into the details of every aspect of what we want to talk about today, I'm going to talk briefly about a very serious health problem. This is a kit for blood sugar assessment. Do you know that the number 3 killer in the United States today happens to be diabetes? Diabetes is when your pancreas literally wears out. Now, back in the day, they used to have something called juvenile diabetes that seemed to impact kids more than adults. Well, today, they also have type 2 diabetes that used to affect adults more than kids. Well, we have an epidemic going on in America today because children today are also now getting type 2 or adult onset diabetes. And you want to know why? It's because of obesity, and they're putting too much sugar into their bodies. And parents, you're partially, and I want to say fully responsible, because you really have control over what your kids do and don't do. You know, it's like monkey see, monkey do. Your kids are duplicating what they see at home. This is so serious because statistically, when somebody is diagnosed with diabetes, do you know how much it costs? $100,000 over the lifetime of that patient. And I think that amount is even low because if you don't take care of yourself, diabetes could result in gangrene. That means you're going to have toes amputated, insulin pumps. You could have diabetic neuropathy. That means you could go blind. So, Dr. Bob, what are you saying? Well, I can tell you in our practice, and I see this so often. First, the number you don't want your blood sugar to be above is 100. If it's fasting blood sugar is above 100, we have to sit down and have a little meeting. You can say, what do you mean a little meeting? That means that you're eating too much sugar. Let's cut to the chase. What do you mean cut to the chase? That means you're cheating on your diet. You have your hand in a cookie jar too much. Because a lot of people in America today want to have their cake and eat it too. You can't do that because you're responsible for a lot of other people. So if you become a diabetic, start having to put insulin, or you're going to start taking a drug. Like some of these drugs, like diabetes, do you know how those drugs really work? Those drugs slap your pancreas so it continues to make insulin until it wears out. Well, we have the ability in our practice, through our assessments, we would talk to you about exactly what you're eating. We'll do a diet history, a diet journal on you. But we have different nutritional products that will help support your pancreas. But what is so powerful, and I just had a lady just last week, took no products at all yet, came into the office, and through spinal adjustments alone, her blood sugar dropped. You say, Dr. Bob, come on. Well, what's happening is because your brain sends messages down the spinal cord to all the organs and tissues. And right in the mid-back region, those are the nerves that go to the pancreas. So your pancreas is not going to function optimally. And people who have blood sugar stress, they monitor on a regular basis. So it's almost like we're doing a case study with people with blood sugar problems. They come in, and I just specifically said to this person, monitor your blood sugar every day. And this person said to me, my gosh, my insulin or my blood sugar has dropped considerably without even making any major lifestyle changes. Isn't that awesome, you guys?
That is awesome.
So we see that. If you have any kind of blood sugar stress, you want to call our office. This is a telephone wire. But this is what your nerves look like. Somewhere along the line in America, we have been disconnected how the body works. Our bodies work by your brain sending 28 billion messages down. Those nerves go to organs. If you're out of alignment because of poor posture, if you're overweight, see, most diabetics are overweight, but not all overweight people become diabetics. You need to move, you need to move, you need to move, and get off those beverages that have sugar in them. Just start looking at labels. Dr. Anthony.
One of the things I think that is most important is being aware of what you're actually putting in your body and doing a journal, what Dr. Bob talked about. That is so important because a lot of times people don't realize the amount of sugar that they're consuming, and doing that over a long period of time is what the diabetic changes happen. So when you start doing that as a child, those changes are going to impact you for the rest of your life unless you change. And sometimes people think it's just a big joke, but it's not a big joke because we're concerned about your health and your body's ability to heal itself. But it cannot do its proper function if you're always giving it the improper fuel. It's one of the things that we like to talk about. If you put the wrong fuel in a motor, it's not going to function properly. So it's just the same thing with the fuel or the food that you're putting in your body is the same thing as the proper type of gasoline or oil. So if you don't do, it's like bad in, bad out. But if you start working on changing your lifestyle, you can get considerable changes that are measurable. One of the things that we've been really encouraging our patients to do is to like us on Facebook. On Facebook, we've been having discussion about topics in healthcare so that outside of this program, you can get impact about some of this information that we're talking about, because knowledge is power, and we want you to know some of the information that we're coming across on a regular basis and how having a healthy, functioning nervous system and spine can result in not having diabetes or problems like that. We want to unlock your full potential from being in our office and being able to be connected with us and the educational tools and information that we have for you.
It's pretty intense, isn't it, Dr. Kaysen?
I know, and I'm just sitting here thinking too, so many times people, they'll come into the office and they say, well, I'm not having any symptoms. I don't have high blood pressure. I don't have diabetes. And they could be overweight, they could be not, but your weight isn't necessarily a good measure of if you're healthy or not, because some thin people out there could be drinking a soda a day, eating cookies every day, and not experiencing pain. But I don't think they realize that eventually that's going to catch up with them. And I mean, some people, it's like they don't even care. They feel good. They're going to eat their cookies. But it is going to catch up with them. And even if they're not having symptoms, eventually when they do get symptoms, that problem's been there. Could be up to years.
So it's kind of interesting is that we're not here to browbeat you. We're here to educate you. And I know that some of the times that we'll make comments that are counterculture. And what always intrigues me is you'll see articles that'll say 60% of Americans are overweight and they have obesity. We have a healthcare crisis in America today. The Supreme Court is looking at a law that is talking about healthcare. So healthcare is on the topics. We have people that are working just to keep their health insurance. And it's like nobody along the line has ever figured out that we are directly responsible for our own health. It's called entitlement. In America today, we feel that we're entitled to have health insurance. And I believe that everybody should have a right to have health insurance. But it's not about higher deductibles. It's not about higher copays. It's about a novel idea. The novel idea is you're responsible for your own health. And you really are. So, and I'm not trying to make you have any kind of guilt conscious about what's going on. But if you're smoking cigarettes right now, it's time to quit. If you have a large pendulous abdomen right now, that means that your liver is compromised. You need to make that wise choice and just cut back and have what we call portion control. It's not about eating in moderation. It's not about being moderate. It's about controlling your body's ability to heal itself. Here's the thought, and I read this, and Stephen Covey said this. If you're not able to control your appetite, you're not able to control any of your other emotions. That's very profound. If you're not able to control your appetite, you're not able to control any of your other emotions. The leading cause of blood sugar stress is being overweight. My concern today is that we have so many young children that are considered and have diabetic challenges. And they also did studies recently that they released information on. It's on Lipitor and statin drugs. Do you know that 50% of menopausal women who take a statin drug become diabetics? Hear what I just said? 50% of women, menopausal women, who take statin drugs become diabetic. Do you know that 50% of them end up having dementia? Do you know what insulin does? Do you know what diabetes does to the body? Causes it to be on fire. Insulin causes pain. Insulin literally will cause your body not to function optimally. This is a fire extinguisher. A fire extinguisher in the human body would be considered oil, flax oil, marine oil, will help put the fire out inside of your body. Well, when you eat food that causes inflammation, you're going to have pain. Here, I want you to do something for me right now. I want you to squeeze your wrist. That's right. Take a moment and squeeze your wrist. Do you feel bone or do you feel fluid? If you feel fluid, you can say, Dr. Bob, what do you mean do I feel fluid? Does your wrist feel boggy? A boggy wrist is a body signal to me that your body's inflamed and it's holding on to water. And that's all a result of some of the choices that you've made. And one of those choices happens to be sugar. The average American consumes about 150 pounds of sugar every year. That's a half a teaspoon of sugar every 30 minutes. I want you to look at the beverages that you're consuming. They're loaded with grams of sugar. Here's another thought. I read a book about the social networking aspect of becoming overweight. And this is what the researcher found. If you could just eliminate the foods that have sugar added to them. So let's just say that you look at a package and it has 10 grams of natural sugar. And then right below it has total sugar. Let's say the total sugar is 19 grams. Now that's not in the box, that's in a serving. So that means if you're eating a serving, you're going to get 19 grams of sugar. For example, this person said if you just eliminated the products alone, which we're going to talk about after the break, if you eliminated the products alone that had sugar added to them and went sugar-free with all the foods you eat and sprinkled 3 teaspoons of sugar on your food during the day, you would lose weight. Isn't that an interesting thought? If you eliminate the sugar-added foods, just that alone.
That's insightful.
And she's going to give you, she said, keep the sugar bowl, but eliminate all the sugar added. And that, they're saying, the sugar added and the fat added foods in our society today are causing a part of the obesity epidemic. And you know, and I mentioned earlier about the medication, so I have a lot of you. And I know that people are watching me right now that are taking those medications that beat up their pancreas. So I want you to write this down. It's called an HA1C. Go ahead, write that down. H, Hector, Alpha 1, Charlie. HA1C. Now listen to me. I'm going to teach you something here. That is the amount of glucose that's on a red blood cell. HA1C, the amount of glucose on a red blood cell. I'm going to predict, I'm going to forecast in the future what's going to happen. If your HA1C is not within normal, you're going to have to start paying more for your own personal insurance premiums. What are you saying, Dr. Bob? I know there are large clinics in the United States right now that if their employees don't pass their test, they have an increase in their own personal insurance premium. That means if you're working for a company and you're not healthy right now, you could start paying more insurance. So let's just say you have to start paying $800 a quarter for your insurance. For yourself personally, that's $3,200 a year. Do you think that's going to make a determination if you're going to eat that sugar or not? Of course it will. We're here to make a difference. We're going to take a short break and we'll be right back.
Welcome back to our half hour to health with Dr. Bob Kaysen and Anthony DeMaria. We're excited to be here with you today. I know that to get more information, you can check us out on Facebook. If you like us at North Coast Chiropractic, you'll be able to find more information along with our videos and books that Dr. Bob has written. I know today we're talking about trans fat and the things that we're putting into our bodies that you might not even know that you're putting into your bodies.
You know, trans fat's kind of frightening too, you know. I don't think that the average person watching us right now, I think they're getting a better grip. But if you have margarine in your refrigerator, you've missed the boat, literally. And for years and years and years, and you know, sometimes I'm on the program and I have a smile on my face and I think, where along the line do people miss it? So margarine, and the doctors that told people to use margarine is wrong. Egg beaters are wrong. Egg beaters are tricking your body. I'll just throw this out to you. God made or man tampered. What do you mean God made, man tampered? Anything that God ate or made, you can eat. Except go to Leviticus, you don't want to eat pork and a few other items. But when man tampers food, well, one of the foods that he tampered with is fat and oil. And there are 2 fat molecule shapes I want to talk to you about today. Normal fat is C shape. A normal fat molecule is C shape. The C's interlock and make cell membranes. That's important, by the way. So C shape. When they twisted or heated those fat molecules,